I'm Dr. Nadeem Sajjad Raja. Today I'm going to talk about chlamydia, a sexually transmitted infection. This infection, chlamydia infection, is caused by a Chlamydia trachomatis, which is a bacteria. It can be asymptomatic, but some patients experience discharge from vagina or penis. Chlamydia usually it can affect any age, but usually it affects young people, both male, female. It's very easy to treat. If it is untreated, then it causes complications. So, what are the signs and symptoms? As I mentioned, some patients are completely unaware because they don't have any sign or symptom. In early stage of chlamydia trachomatis infection, signs and symptoms are very mild. But as soon as the disease progresses, the signs and symptoms become worse. For example, pain while passing urine, vaginal discharge in women, discharge from penis in men, painful sexual intercourse in women, bleeding during the periods or after the sexual activity in females. Men also experience testicular pain. Chlamydia can also infect rectum, especially men who are having sex with men. They can be asymptomatic, and if there are symptoms, then there is a rectal pain, discharge, and sometimes rectal bleeding as well. Chlamydia trachomatis also causes conjunctivitis or eye infections. Chlamydia trachomatis spreads from one person to the other person through vaginal, oral, or anal sex. Pregnant women, if they get infected during their pregnancy, can pass chlamydia to their newborn, and newborn suffer with severe pneumonia, eye infection. These could be really life-threatening infection. So who is at risk of acquiring chlamydia trachomatis infection? Women, especially if they are sexually active before the age of 25 years, or if someone is having multiple sexual partners, not using condoms, preventive measures, or there is already a history of sexually transmitted diseases and also transmission of other sexually transmitted diseases. If it is untreated, the treatment is very easy, but if untreated or partially treated, then there are serious complications. For example, pelvic inflammatory disease. Pelvic inflammatory disease is actually infection of the uterus and fallopian tubes. That causes pelvic pain, fever. This infection can be severe, and if the infection is severe, it requires hospitalization. Then patient will go on intravenous as well as oral antimicrobials. Pelvic inflammatory disease can damage or destroy fallopian tubes, ovary, uterus. Infertility is an important complication of untreated or partially treated pelvic inflammatory disease. Chlamydia also causes infection of coiled tube, which are around both testes. That is, this disease is also called as epididymitis. Patient in this epididymitis suffer with scrotal swelling, pain. Another complication which is very important, that is called as ectopic pregnancy. This occurs when a fertilized egg is implanted in the fallopian tube. That means it grows outside the uterus. In this, to save the life, it is very important the consultant will be consulted, and then consultant will decide. Usually the removal of pregnancy or termination of the pregnancy is the best solution. There is also reactive arthritis. That means after chlamydia infection, the joints are also painful and swollen. So how? chlamydia infection is diagnosed. Screening is very important, especially women who are less than 25 years old and sexually active, pregnant females, in order to prevent transmission to newborn, people who are at risk of acquiring chlamydia infection, for example, if their behavior is risky behavior. So whenever you will go and see the doctor, so doctor will do a few tests after taking care of history and examining the patient. Urine and urethral or vaginal swabs will be done for PCR. That is also called as nucleic amylic acid test. After the confirmation of chlamydia infection on the basis of clinical history, sexual history, as well as laboratory confirmation, so doctor will suggest the treatment. So it is either azithromycin or doxycycline. So doctor will decide which antibiotic should you take. Either it's a one dose or you have to take for a longer period. If pain is severe, then painkillers will be prescribed. Infection usually resolved in a week or 2 weeks, but during this time abstain from sex and your partner must be treated. Otherwise, once you are cured, then partner may transmit or transfer chlamydia to you. Prevention. It is very important that practice safe sex. Use condom, avoid multiple sexual partners, do regular screening, especially young adults. Avoid douching because it decreases the total number of bacteria. Then there are more chances of infection due to chlamydia and other sexually transmitted infections. Very important question. Many patients ask me, can chlamydia come back? Yes, it can come back, especially if you do not take medicine as your doctor advised you. It means partially treated infection. Doctor usually suggests a follow-up after 3 months to make sure that infection has been cured. It can come back if there is a new sexual partner who is already infected with chlamydia, can pass chlamydia to new partner. Some people use sex toys. If they are contaminated with chlamydia, yes, chlamydia can be passed. Thank you very much for watching this video. Please do subscribe my channel, Dr. Raja Nadeem Sajjad, and press bell icon button, then you will receive all my latest videos.